Dear doctors, this is Dr. Toom, and welcome to the CDB audio flashcards board exam coaching pearls. I wish you luck and success. See you at the finish line. What is the role of melatonin in the treatment of COVID-19? Based on this journal, melatonin can be used as an adjuvant treatment for coronavirus pneumonia patients requiring hospitalization. Please be aware of the high-dose melatonin, or the HDM, wherein doses of 36 to 72 milligrams per day in 4 divided doses is given as adjuvant therapy. Now, what about the role of dexamethasone for the treatment of COVID-19? So based on the recovery trial, which is the randomized evaluation of COVID-19 therapy, the UK recovery trial concluded that hospitalized patients with COVID-19 were given low-dose dexamethasone for 10 days. The magic number is dexamethasone 6 milligrams. And what were the results? The incidence of death was lower in those who received the low-dose dexamethasone. However, this was in the group of COVID-19 patients who required invasive mechanical ventilation and those who were receiving oxygen, which means the subset of patients which benefited from dexamethasone were those who had moderate to severe COVID-19 infection. Now, what is the ERAS protocol? So ERAS stands for Enhanced Recovery After Surgery. These are the components of your ERAS. This is the Enhanced Recovery Program. So preoperatively, you have optimization, prehabilitation, bowel preparation, reduced fasting, and carbo loading. Postoperative, you have prophylaxis for ileus, perioperative nutrition, early mobilization, early removal of catheters and drains. And intra-op, minimal invasive procedures, fluid balance, normothermia, and fast-acting anesthetics. Now, what about coarctation of the aorta? This is associated with Turner syndrome. Classic manifestations would be short stature, webbed neck, widely spaced nipples, bilaterally streaked ovaries or ovarian dysgenesis, hypertension in the upper extremities, a radiofemoral delay, rib notching on the X-ray, and the presence of the 3 sign on your chest radiograph. Now, what about a flail chest? This is defined as 3 or more contiguous ribs, which are fractured in at least 2 locations. The most common underlying cause of morbidity and pulmonary compromise would be the presence of a pulmonary contusion. Now, what about congenital diaphragmatic hernia? Don't forget, the anterior congenital diaphragmatic hernia is your Morgagni's diaphragmatic hernia. The posterior diaphragmatic hernia is your Bach-de-Leck. So always remember, the most common location of your Bach-de-Leck's hernia is posterolateral. Now, what about the different types of hernias that you should bring with you to the boards? Don't forget, a Spigelian hernia is a lateral hernia which is found in the junction of the semilunar line and the Arcuate Line. An Amyand hernia, the letter A, capital letter A, is letter A, the appendix. So an Amyand hernia is an inflamed appendix within an inguinal hernia. What about Litter's hernia? This is a hernia containing a Meckel's diverticulum. What about Richter's hernia? This is a hernia wherein only the antimesenteric wall or a portion of the bowel herniates. Now, what about breast cancer? The most common type of breast cancer is your invasive ductal breast carcinoma. The one with the worst prognosis is your inflammatory breast CA. Your Paget's disease of the breast is characterized by eczematous lesions in the nipple, and this is associated with cancer. Now, the most common site of breast cancer is the upper outer quadrant, because this has the most abundant breast tissue. Now, what about the dimpling of the skin? This is caused by retraction of your Cooper's ligament. What about your Peau de Orange or your orange peel appearance? This is because of invasion of your subdermal lymphatics. This is usually encountered in inflammatory breast carcinoma. Now, what about the shoulder joint? The most common type of shoulder dislocation is anterior. And when you have an anterior shoulder dislocation, always remember the axillary nerve can be damaged. Now, what about your elbow dislocation? The most common type of elbow dislocation is posterior. Now, what is lateral epicondylitis? This is your tennis elbow. Medial epicondylitis is your golfer's elbow. Now, what about your Colles fracture? This is a dorsal or posterior displacement of the distal fragment of the radius. This presents with the silver fork deformity. A Smith's fracture is a reverse Colles fracture. It is a volar or anterior displacement of the distal fragment. A green stick fracture occurs in children. This is when you have an incomplete break in the cortex. And this is more common in children because the bones of children are softer and more pliable. Now, an isolated radial fracture, the most frequent, is your Galeazzi's fracture, which is also considered as a reverse Monteggia's fracture. There's a fracture of the distal radial shaft accompanied by a dislocation of the distal radio-ulnar joint. Now, what about your Piedmont fracture? This is known as a fracture of necessity or a reverse Monteggia fracture. So you have a fracture of the radial shaft with a dislocation of the distal radio-ulnar joint. This is your Piedmont fracture. Your Boxer's fracture is a fracture of the fifth metacarpal. Your Bennett's fracture is a fracture of the first metacarpal. And the most common carpal bone fractured is the scaphoid bone. The most common carpal bone dislocated is the lunate bone. Now, please take time to review your Gustillo and Anderson classification of open fractures. Your type 1, the wounds are less than 1 centimeter. Type 2, the wounds are 1 to 10 centimeters with moderate contamination. Type 3A is minimal periosteal stripping. Type 3B has soft tissue coverage and significant periosteal stripping at the site of the fracture. Type 3C indicates an associated repairable vascular injury. This is your Gustillo and Anderson classification for open fractures. Then we have the Glasgow Coma Scale, or your GCS, wherein you have 3 parameters: best eye response, that's the E; best verbal response, that's the V; then the best motor response, or the M. Highest score is 15, lowest score is 3. GCS of 8, you might want to consider intubation. Now, what about your Waterhouse classification on surgical timing for your tracheoesophageal fistula? We have 3 categories: category A, B, and C. And these are the requirements. Category A the baby should be more than 2,500 grams. Category B, the comorbids is 1,800 to 2,500 grams. The presence of pneumonia or congenital anomaly. Category C, the weight is less than 1,800 grams with the comorbidity of severe pneumonia or congenital anomaly. It is category A that can undergo surgery. Now, what about otitis media? The most common organism is Streptococcus pneumoniae. So you have your classic ear discharge or the presence of purulent ear discharges. Now, what about otitis externa? The hallmark of otitis externa is tragal tenderness. And diffuse otitis externa is also known as your swimmer's ear. This is caused by Pseudomonas aeruginosa. Now, heads up, Pseudomonas aeruginosa is also the most common cause of ventilator-associated pneumonia, as well as the most common organism encountered in severe burn infections. Now, what about Ramsay-Hunt syndrome? It has the triad of the presence of vesicles near the ear, the presence of otalgia or ear pain, and ipsilateral facial palsy. Then we have Meniere's disease, where you present with hearing loss, vertigo. So the basic pathophysiology of Meniere's is excess presence of fluid, which causes swelling and pressure. So how do you manage Meniere's surgically? You do endolymphatic surgery. Now, please review your rule of nines for the management of burns, and please take time to review your Parkland's formula for the management of burns. Then we have our Adson's test, wherein the significant finding is the loss of your radial pulse. A positive Adson's test is diagnostic of thoracic outlet syndrome. So don't forget, in thoracic outlet syndrome, this is associated with a cervical rib or a hypertrophic scalenus muscle. So what is compressed is the neurovascular bundle and significantly the subclavian artery. Now, what about your Froment sign? The Froment sign is indicative of ulnar nerve injury. What about your Fothergill sign? It is indicative of the presence of a rectus sheath hematoma. This is usually due to trauma and rupture of your inferior epigastric vessels. Trousseau's syndrome is migratory thrombophlebitis, which is usually associated with your pancreatic carcinoma. Then we have Borchardt triad, which is encountered in gastric volvulus. The triad is epigastric pain, vomiting, and inability to pass the nasogastric tube. What about your Mackler's triad? This is encountered in Borheave syndrome, which is a spontaneous pressure rupture of the esophagus. So this is the triad: vomiting, chest pain, and subcutaneous emphysema, or the presence of a positive Hamann sign. Now, don't forget, the most common site of esophageal perforation is your Killian's triangle. So this is a small triangular area which is found in between your cricopharyngeus muscle and the inferior constrictor. This is also the most common site of a Zenker's diverticulum. Now, don't forget your Beck's triad, which is seen in pericardial tamponade. The triad is hypotension, engorged or dilated neck veins, and the presence of muffled or distant heart sounds. Now, please don't forget, you see the water bottle sign on chest x-ray, and management is pericardiocentesis. Now, what is the surgical procedure we do to control massive or life-threatening hemorrhage from the liver? wherein you do outflow obstruction or you clamp the hepatoduodenal ligament. So this is your famous Pringles maneuver. Now, what is the role of your AMACR? Your P63 and your AMACR. What is your AMACR? This is your alpha-methylacyl-CoA racemase. This is a sensitive enzyme which can be used as the marker of prostatic basal cells or metastatic prostate CA. Now, the difference between a scaphoid fracture and a hamate fracture, correlative anatomy, and manifestations. So the scaphoid fracture would usually damage the radial artery. This is going to present with tenderness over the anatomic snuff box. And this is associated with avascular necrosis of the scaphoid bone. Your hamate fracture would most likely injure your ulnar nerve, and this presents with, number one, the inability to spread and oppose your fingers. And it presents with a decreased grip and a decreased strength of the hand. So there's going to be inability or difficulty in clenching the fists or closing the hands. Now, what is a teardrop fracture? This results from a posterior subluxation of the vertebrae, and it is usually associated with hyperflexion of the neck. What about a whiplash injury? This is associated with hyperextension of the neck, and the mechanism here is a tear of the anterior longitudinal ligament. So what is a fracture of the first cervical vertebrae or your atlas? So this is known as a Jefferson's fracture. This is also considered to be a burst fracture. So don't forget, Jefferson's fracture is a fracture of cervical 1. Now, what is a fracture of the second cervical vertebrae? This is a hangman's fracture. So a hangman's fracture is a bilateral fracture of the pars interarticularis. Cervical 2 is involved. Now, what is a fracture of the seventh cervical vertebrae or the cervical prominence? This is known as a clay shoveler's fracture. So a clay shoveler's fracture is a fracture of the spinous process of cervical 7. Now, what is the unhappy triad of O'Donoghue? This usually results when there's a lateral blow to the knee when the foot is fixed, such as injuries during football, basketball, and rugby. So the triad is a tear of the medial collateral ligament, a tear of the anterior cruciate ligament, and a tear of the medial meniscus. Now, what is the test to diagnose an anterior cruciate ligament injury or an ACL tear? This is your Lachman's test. Now, how do you diagnose a posterior cruciate ligament injury? You perform your posterior drawer tests. It would be wise to review your Ortolani and your Barlow's maneuvers. So, what is the test which will diagnose a tear in the medial meniscus? So letter M for medial meniscus is letter M, your McMurray test. Now, what about compartment syndrome? It usually presents with pain. Later signs would be paralysis, pallor, paresthesia, pulselessness. Management of compartment syndrome would be a fasciotomy. And the most common compartment involved is usually the anterior compartment of the leg. Now, what about some drugs? Chemotherapy of choice for choriocarcinoma is methotrexate. Now, please don't forget, methotrexate has a triphasic plasma clearance. The initial plasma distribution is a half-life of about 0.75 hours. The second half-life, which represents the renal clearance, is about 2 to 3.4 hours. And the third phase has a half-life of about 8 to 10.4 hours. So triphasic plasma clearance. Now don't forget the enzyme which methotrexate inhibits. It is dihydrofolate reductase, a dihydrofolate reductase. Then the drug given to decrease the toxicity of methotrexate is leucovorin, also known as your folinic acid. So this is the principle of leucovorin rescue. Red man syndrome can be caused by vancomycin. It can also be caused by nicotinic acid, and it can also be caused by the calcium channel blocker, nifedipine. Now, what is the common drug that causes pseudomembranous colitis? It is clindamycin. Now, don't forget cephalosporins as well as quinolones can also cause pseudomembranous colitis. Now, what about phenytoin? This is an antiarrhythmic as well as an anticonvulsant. This is contraindicated in pregnancy because it causes fetal hydantoin syndrome. Now, don't forget, phenytoin can be proarrhythmic when it's infused too fast. Phenytoin can cause hirsutism. Phenytoin can cause gingival hyperplasia. Toxicity of phenytoin is when the phenytoin levels are more than 20. This usually presents with nystagmus and ataxia. Now, ACE inhibitors are associated with cough because of the involvement of bradykinin. ACE inhibitors are contraindicated in pregnancy because it causes fetal renal agenesis. Now, isoniazid, which is an anti-TB drug, can cause peripheral neuropathy, and the antidote for INH toxicity would be pyridoxine or your vitamin B6. Now, the most common drugs that can cause Stevens-Johnson syndrome. So we have sulfonamides, anticonvulsants, and allopurinol. So if you have a patient with history of significant allergies and the patient presents with leprosy, what drug would you avoid? You would avoid dapsone, which is a sulfonamide. Halothane can cause hepatitis. It can also cause malignant hyperthermia. Now, please don't forget, another anesthetic that can cause malignant hyperthermia is succinylcholine. And the treatment of malignant hyperthermia is your dantrolene. So don't forget, dantrolene inhibits your ryanodine receptors of your calcium channels. Ketamine is considered to be a dissociative anesthetic, while cyclophosphamide is notorious for causing hemorrhagic cystitis. We usually treat hemorrhagic cystitis by giving the drug Mesna. Now, doxorubicin and daunorubicin are notorious for causing cardiac toxicity. Chemo drugs used for your lymphoma, the CHOP regimen, which is comprised of cyclophosphamide, doxorubicin, vincristine, and prednisone. The R-CHOP regimen simply adds rituximab. Now, what two drugs are notorious for causing nephrotoxicity and ototoxicity? Number one on the list is your antibiotic aminoglycosides. Number two on the list is your cisplatin. So don't forget, aminoglycosides along with your tetracyclines will block your 30S subunit. The loop diuretic furosemide also causes ototoxicity. And don't forget, the anti-TB drug streptomycin is contraindicated in pregnancy. Now, tamoxifen, which is used for estrogen-positive breast cancer, carries the side effect of endometrial carcinoma. Now, these are your SERMs, or your selective estrogen receptor modulators: clomiphene, tamoxifen, raloxifene, torimifene, and ormeloxifene. Ormeloxifene is used to treat endometrial bleeding, while clomiphene is considered to be a widely used fertility drug. So what is used for endometrial bleeding? It is ormeloxifene. Now, what drug is given preoperatively to decrease the vascularity and the size of the thyroid prior to surgery? This is your Lugol's iodine, or your SSKI, your saturated solution of potassium iodide. During pregnancy, the antithyroid drug we can give is your PTU, or your propyl thiouracil. Now, what is the drug of choice for prophylaxis of leptospirosis? So we have doxycycline. Now, what is the treatment for chronic gout? It is allopurinol. Acute gout is treated with the mitotic spindle inhibitor colchicine. Allopurinol inhibits xanthine oxidase. Allopurinol can also be used to treat your Lesch-Nyhan syndrome, wherein you have a deficiency of the enzyme HGPRTase and a child presenting with mental retardation, hyperuricemia, and self-mutilation. So don't forget, the drug allopurinol should be used in caution with the following immunosuppressants or anti-cancer drugs. This is mercaptopurine, or your 6-MP, and your azathioprine, because allopurinol inhibits your purine analogs. Now, what is the non-purine selective inhibitor of xanthine oxidase? This is your drug febuxostat. And winding down, thalidomide. This is teratogenic and causes the seal-like extremities, or the focal melia. This is known as the thalidomide tragedy. And please don't forget, the Chernobyl disaster was associated with papillary thyroid carcinoma. So winding down with these audio flashcards, what is the drug of choice for the treatment of heparin toxicity? It is protamine sulfate. Drug of choice for organophosphate poisoning, we have atropine, and we can also give pralitoxine. Then we have the drug of choice for adriamycin or doxorubicin toxicity. This is dexrazoxane. And lastly, the treatment for benzodiazepine toxicity is flumazenil. And one for the road to perfect your exam. Drug of choice for heparin toxicity, protamine sulfate. So this ends our very quick Board Pearls audio flashcards. This is Dr. Toon saying, in behalf of cracking the boards, God bless and Godspeed in your exam. See you at the finish line.